One of the biggest accomplishments in human history is the dramatic rise in life expectancy during the last centuries. As societies get richer, people get to live more years on average. This is a key indicator of our quality of life. It reflects the impact of living standards, lifestyles, and the healthcare system as a whole. The rise of life expectancy has happened all over the world, and we have certainly enjoyed this transformation here in the United States. However, when you look at the data from the last years, you come across something strange. Take a look at this graph. This is the life expectancy for the United States over time. As you would expect, the line goes up. But now, look at the lines from other high-income countries. The U.S. starts in the middle of the pack, but as time goes by, we are clearly falling behind. Now, if you are not surprised by this, consider that the United States is the biggest economy in the world, and also that we spend far more on healthcare than any other country. These lines represent healthcare spending in high-income countries, and this right here is us. If we are the wealthiest nation and we spend the most on healthcare, why aren't we at least near the top? To make matters more confusing, during the last decade, life expectancy has actually decreased in some places. First, if we compare across states, we see that in some of them, life expectancy resembles that of other high-income countries, while in others, it's closer to that of middle-income countries like Honduras or Armenia. If we zoom in to the county level, the life expectancy gap is even bigger, ranging from a low of 66 years to a high of 87 years. This is a 20-year gap. There are even places within the U.S. where life expectancy is actually going down, which is nothing short of baffling. What we are seeing reflects large and perhaps widening geographic disparities in the U.S. So why is the United States falling behind in terms of life expectancy? Too much fast food? Not enough exercise? Well, actually, this is a very complex problem. It's not something that can be easily explained. We need to consider how everything from local environmental conditions to state policies impact health across the life course and how these factors drive differences in life expectancy across the U.S. Take air pollution, for example. Surely there's a link between the quality of the air we breathe and the number of years we can expect to live. But how strong is that link? How does it compare to, say, tobacco consumption or even tobacco policy and the way it affects consumption? Right now, across the country there are hundreds or even thousands of researchers focused on questions that are related to life expectancy, but they are not necessarily working together. We need to link all of their research in order to understand why the U.S. is falling behind. And so, the NIA-funded Network on Life course, Health Dynamics and Disparities, exists to bring together an interdisciplinary group of scientists at the forefront of research on the social determinants of U.S. population health and health disparities. The network is set up to encourage and support collaboration. We have training opportunities, we developed resources and created mentoring programs so that new researchers can join the network and start sharing information with the rest of the community. Remember these graphs and maps and the alarming puzzles they show us? Well, we want to understand the story behind them. We are looking at things like federal, state, and local policies, healthcare and long-term care resources, and neighborhood conditions. We are working not only towards understanding each piece of the puzzle, but putting it all together so we can address the recent and growing U.S. health and longevity crisis.